Welcome to week 16 of your pregnancy, mama. You are 4 months pregnant, which means you're almost at the halfway point of your pregnancy. That is pretty remarkable. If you're just joining us, I'm Bridget Tyler. I'm a birth doula, childbirth educator, and a mama myself of 2 kids with another on the way. I love empowering parents with education, so if you haven't yet, be sure to subscribe and hit the bell so you don't miss out on any future videos. So what's going on with you and your baby at 16 weeks? Well, your body is starting to create your baby's first milk already, called colostrum. This milk is so nutrient dense and is your baby's best, most protective, nourishing food that you can give them. Your body will continue to make this colostrum until the birth of your baby and the birth of the placenta, at which point you'll start making a different kind of milk, a more mature milk. If you compress your breast, you might notice that some colostrum comes out, but if you don't, that doesn't mean it's not in there. It is. I know breastfeeding seems a long way off right now, mama, but having resources in line for when you're in the middle of it and maybe struggling is so helpful. So many mamas are focused solely on birth that they miss out on preparing for breastfeeding. So check out some of my YouTube videos that are linked down below, as well as the breastfeeding course that I've created for you, linked below as resources to use now to educate yourself in pregnancy, or just to save for later when you need them. Now this week, you'll likely have another appointment with your care provider, or it's going to be happening around this time. An important question to ask at each appointment is, what can I expect at my next appointment? There's nothing worse than being blindsided by a procedure, a test, or screening that you weren't ready for, you don't know much about, or feel uncomfortable with. So from this point on, always ask your midwife or OB before your appointment ends, what can I expect at my next appointment, so that you have time to research it yourself. Your next appointment after this one will likely be the 20-week anatomy scan if you choose to get it. Now, your 16-week baby bump may be still a little too small to show that you have a beautifully growing baby in there, or it's already big enough that you're needing maternity clothes. Every woman and even every pregnancy is so different for belly growth and is not a reflection of how healthy or well your baby is growing inside your womb. So don't compare your bump with anyone else's. Celebrate it, take photos of your growing belly, and remind yourself how incredible it is that your body is nourishing life within it. And if you need any recommendations for maternity clothes, I have some links in the description below for you. Now let's talk about what's going on with your sweet little baby. Your baby's eyes are starting to move under their still closed eyelids, mostly from side to side, and they're starting to pick up light. If you put your bare belly under sunshine or shine a flashlight over your belly, your baby is differentiating that light change. It is so cool. Your baby's heart is pumping about 25 quarts or 100 cups of blood per day through the circulatory system, and that's starting to get up and running. You'll be able to hear your baby's heartbeat through the Doppler if your provider uses one during your appointments, and it'll be between 110 and 160 beats per minute. And as your baby's body is getting stronger and stronger, they're going to be moving around a lot more, and they can make a fist with their hand and even grab onto their umbilical cord. Comment down below if you're feeling any movements from your baby yet. If you're not, that's not something to worry about. Usually it takes longer to pick up on baby's movements in your first or second pregnancies. Well, mama, that is it for this week's update. I hope you have a beautiful 16th week of your pregnancy, and I'll see you next week.